Hi everybody, it's Allison Hrovat and I'm back for Lesson 4, the last of our online learning modules on trauma and trauma-informed care, prepared for the Department of Developmental Services specifically with you in mind. Our last lesson today is on a trauma-informed lens, and this is where we'll unpack the idea of being trauma-informed and what that means in the work that you do. I cannot promise that today's lesson will be 15 minutes, not that any of the others have been, but today will be more like 20 or 25 minutes. And the reason for this is that this is the lesson that ties together all of what we've been learning up to this point. My hope for you today is that by the end of this lesson, you'll have a really good idea of what it means to be trauma-informed, and you'll be able to see how that applies to your own life and work. So our learning goals for today are to develop a really strong understanding of what it means to be trauma-informed and what it means to look through a trauma-informed lens. We're also going to talk about the practice of trauma-informed care and how that connects to some of the current practices, including person-centered planning. We're going to finish with a discussion on vicarious trauma and self-care. And just because I've left this for last, I don't want to imply that it's the least important. In fact, I think it's one of the most significant components to providing trauma-informed care because there is a high likelihood of vicarious traumatization in all of the work that we're doing. And so if we're not taking care of ourselves, we're not going to be present for the experiences of those we're working with. And it's really important that we do so. So I want to make sure to spend some time talking about that. As always, as you're watching this video, I encourage you to attend to your own self-care. Nothing in this video has been intended to be triggering or provocative in any way, but anytime we talk about trauma, there's a possibility that our own experiences can be activated. So I want to encourage you to go through this at your own pace, take breaks, pause, make sure you're taking some really deep breaths, so that you can be fully present for the information included here and can maximize your learning opportunities. So from the beginning of these online learning modules, my overarching goal has been to provide an understanding for you about living in a trauma-informed world and what that might look like. And so the way that I've gone about this is to first hopefully provide you with an understanding of trauma and looking at the ways that trauma impacts the brain, the lives of individuals, families, communities, and what trauma looks like in its presentation. And then hopefully I've also provided you with an opportunity to not only experience compassion for those who have experienced trauma on an emotional level, but to start thinking about the way our world might be triggering or difficult for individuals with trauma. And in between those two domains of understanding trauma and having compassion for those who have experienced trauma, that's where I believe the idea of a trauma-informed world is situated. And so my hope today is that we have a really clear understanding of what it means to be trauma-informed and how that can look in your own work. So across the span of these videos, you've probably heard me use the phrase trauma-informed quite a bit, and you might have wondered what that means. The idea of being trauma-informed is that all of our actions in terms of our treatment and our interventions with individuals who experience trauma are grounded and directed by our understanding of trauma. And when I say that we have an understanding of trauma, it's a very thorough understanding. So we're able to understand the impacts of trauma biologically, psychologically, neurologically, and socially. And that we understand that trauma can affect all of these different corners of a person's life and reality. When we're being trauma-informed, we're recognizing and acknowledging that trauma impacts the way an individual experiences the world, and that any of the work that we do with a person who's experienced trauma should be first grounded and centered in their experience of trauma. So for example, when we're planning a treatment plan and we know the person has experienced trauma, we want to think about their experience of trauma as being primary to determining what kinds of actions, interventions, supports, etc., that we surround them with. When we're trauma-informed, we recognize that most people in the world have experienced trauma. And in fact, part of me being a trauma-informed counselor is that I walk into any room, whether that's a movie theater or the doctor's waiting room or a subway station, and I look around me and I know that most of the people in that room have experienced trauma. And in fact, many of them will have experienced multiple traumas. So being trauma-informed recognizes that trauma is very prevalent in our society and that we need to be able to acknowledge and understand the impacts of trauma in order to provide successful care, supports, and resources to individuals who have experienced trauma. A trauma-informed approach doesn't really focus on curing trauma because we don't think about trauma that way. It focuses instead on resilience and recovery. That we want to help people to maximize the supports and resources and resiliency factors that they have in order to cope with the trauma so that they can continue a life of recovery where they're always overcoming the trauma and they're always working towards a life where they don't feel as ruled by the trauma that they experienced. So being trauma-informed means that we recognize that at any given moment, a trauma survivor is doing their very, very, very best to survive the symptoms of the trauma that they experienced. And we recognize that there are neurological scripts, and by this I mean stories that our brain has written because of the trauma, that tell us that at any given moment we're in danger. We might lose everything. We might lose the people that we love. We might be persecuted for the person that we are. That smoke detector that we talked about that's in the brain is constantly going off, and it's constantly saying, hang on, this reminds us of that scary thing that happened, and so you might be in danger. And so part of the resiliency and recovery process is to get trauma survivors to a place where they can say, hold on a second, this reminds me of a time that I was in danger. Am I in danger, or does this just remind me of being in danger? And so being able to work towards that process of identifying when something is dangerous and when it's a symptom of trauma that's being triggered is really essential. Trauma survivors have a challenge to living in the present. They're worried about everything that happened in the past and what they could have maybe done different to prevent it. And they're worried about the possibility of those kinds of things happening again in the future. So helping a trauma survivor to find ways to live in the present moment is really critical, and it's a really big part of what it means to provide trauma-informed care, that we recognize that that challenge exists and we work towards helping people have an existence in the present moment. So when we use a trauma-informed approach to our work, a lot of things shift. One of the things that clearly shifts is that we recognize that using aversive and restrictive practices are recognized as being problematic for trauma survivors, that there's a high risk of re-traumatization and escalation, damage to the relationship when we use those kind of practices. And so we need to be really mindful that if we're using any kinds of practices that are aversive or restrictive, for example, if there's a safety threat and someone needs to be put in some sort of a hold, that we recognize that there's a high risk of re-traumatization and we're prepared to support the person through that. And we always want to use those kinds of techniques as minimally as possible, especially if the person is in a position where they might not understand the rationale for using those or the safety measures that are in place surrounding those. When we're using a trauma-informed approach, whenever possible, we want to inform people about what's going to happen before it happens. So making sure that people know, okay, now I'm going to give you a pencil, or now I'm going to take that item away from you. Now there's going to be a loud sound because there's construction going on outside. We want to do that whenever it's possible with a trauma survivor, and of course it's not always possible. But a trauma-informed lens, we want to use that lens to help us see the possibilities that might be coming ahead, to prepare people whenever we possibly can. In a trauma-informed approach, we see that trauma symptoms and trauma responses are seen as resilient adaptations instead of manipulations or problematic behaviors. So we see that people using trauma responses are using protective actions and not problematic behaviors. For example, if someone had an experience of being hurt while using a certain type of equipment, and the next time they refuse to use that equipment, instead of seeing that as them being defiant and not willing to engage in a certain process, we see that as them being protective and doing the right thing to protect themselves from being hurt again. So we really want to start looking at behaviors and thinking, how could this be a protective behavior? Instead of deciding that these behaviors are problematic or in some ways defiant, we want to think about how they could be purposeful to that person. In a trauma-informed approach, of course, we are always aiming to demonstrate empathy. Real empathy, the kind that takes work, where we start really thinking about what would it be like to have experienced that and to be now trying to cope with these symptoms. And that we recognize that trauma symptoms and behavior are rooted in a deep sense of pain. Again, we want to remember that the mind is always doing the very best job that it can to cope with trauma, even when, and sometimes especially when, it doesn't look very pretty. So when we see aggressive behaviors, when we see things that can be high risk, that even though we need to intervene, that we recognize that those behaviors are rooted in a deep sense of pain. We want to try and present people with choices, and we want to try and present them with real choices, not fake choices. So we want to offer them two choices that they can equally choose between that will give them a sense of empowerment and advocacy and agency in their own life. Because a lot of times a traumatic experience is about not having power in the moment, having to respond to a moment where somebody else is in control or natural disaster forces are in control. And so these traumatic things that happen, a lot of times people feel like they had no power, they had no control over what happened. So if we can build in an element of choice as much as possible, that helps to restore a sense that they're going to be able to have options in their life. So we also want to think about the idea of limit setting and rule enforcing. And we know that those things have to happen, right? We have to set limits, we have to enforce rules. But through a trauma-informed lens, we also want to recognize that those kinds of things can be triggering in some ways. And so we want to be able to set those limits and enforce those rules in a way that also respects that there might be a traumatic response associated with them. So doing the best that we can to respect the underlying emotions that are happening when somebody responds to a limit being set. Recognizing, I know that this is difficult for you. I know this might be scary for you. So that there's a recognition that there are some emotions attached to what's happening. And so when we're being trauma-informed, we put trauma in the center of everything that we do and the way that we think about the interventions and supports that we provide. So we think about trauma-informed care and the different kinds of approaches that we've seen used throughout the course of development in the Department of Developmental Services. What we see is that there has been a lot of alignment with this trauma-informed idea. So starting back when we were focused on non-aversive behavioral supports. And so this was just the simple idea that we could modify behavior without inflicting punishment, that we could focus on behaviors and prevent harm without there being a constant punitive element to what was happening. And so we started using methods like training staff, and we started focusing on training all of those around the people with disabilities so that they would be prepared to help shift behaviors and respond to behaviors in a non-aversive way. And so the core values of that movement were to do no harm and to try and have control over the behaviors in a way that was not harmful to the individuals. And obviously we've come a long way since then. When we think about positive behavioral supports, the focus was on understanding the perspective of the individual. And what we do here is we look at the person's skills, their knowledge, their experiences, and we focus on things like education and communication. So instead of controlling behaviors, we're moving away from that towards this educational approach, that focuses on communication. And so this value is giving people choices, collaborating, helping people to develop self-control and self-determination, and including people socially. So you can see that that is leaps and bounds from the non-aversive behavioral supports, and that it starts moving closer and closer to this idea of a trauma-informed approach. And then thinking about person-centered planning, we start moving even closer. So person-centered planning provides a way for people to plan aspects of their life. Here we're giving people some control and some voice and some input in what happens in their life. That they're at the center of the planning, and that the plans that are created that will impact their life involve them. And that's really significant because that speaks to exactly what I said in the last slide, that in trauma-informed care, we want to give people as much of a choice as we can. And so the core values here are surrounding choices, collaboration, autonomy, self-determination, and communication. All of these things are so closely aligned with what we're talking about when we think about looking at life and the experiences of the people we work with through a trauma-informed lens. So now that we've talked a little bit about what it means to have this trauma-informed lens, I want to talk about your role as a service provider and how you can fit into this trauma-informed puzzle. I can say that for myself, having this understanding of trauma has really shifted the way that I view so many things, the way that I think about myself and my family and friends, the way that I think of other people in my community, my students, my clients, people that I interact with casually on a daily basis. It shifts the way that I read the news. I mean, it gives me a different way of looking at life, to know that most people survive some sort of trauma, and that trauma has this really significant impact on the way that we experience the world and the way that we respond in relationships and to different experiences that happen in our life. When I think about helping people to come up with a way to be trauma responsive, a lot of the questions that I get are, what do I do? What do I do if somebody tells me that they themselves or that their child or that their family member has experienced something traumatic? And a lot of fears come up, and I think the fears are common, that people share these fears because this topic of trauma has always been a little bit scary. So people have fears about, do I need some sort of special training? Will what is happening hurt me and trigger my own trauma? How much detail should I ask for? What if the person tells me something that's not true? What if they lie or exaggerate? When is the right time to ask questions? Do we have a good enough relationship? What if their story is inconsistent and I'm not sure about it? And what if talking about it for them is re-traumatizing? So the first thing that I want to say is that one of the things we've learned about trauma over time, there used to be this belief that for people to recover from trauma, the most important thing was for them to debrief. And debrief meant talking about the trauma over and over again in lots of detail until they were desensitized, sort of. And what we know now is that that's not the path to healing for many people. And really, it's not about people having to provide for us detail, but for them to be able to do what is necessary for them to heal. And so I think, first of all, it's important to know that there's no reason why up front you would need to ask detailed questions or be prepared to hear detailed information, because that's not the path to healing for most people. Years ago, I was working at a rape crisis center, and my colleague and I were doing trainings for first responders in schools. So a lot of times these were teachers or psychologists, school counselors, and they wanted to have a better way of responding when students disclosed some sort of sexual abuse or assault. And I think a lot of times the fear is that when somebody shares something like that, as mandated reporters and oftentimes first responders, we feel pressured that the first thing we need to do is do something. We need to call somebody, we need to document it, we need to make a report. And what we find in looking from a trauma-informed perspective is that in rushing towards those actions, we miss some critical opportunities to provide some support early on. So we came up with this little acronym, BLABIT. Hopefully this helps you to have a way of remembering how you might respond. And so the B in BLABIT stands for breathe. The first thing we want you to do is to take a deep breath and to center yourself and to know that you need to be really present for what's going to happen. And then the second thing we want you to do is to listen. And then we want you to affirm. I'm so glad that you're telling me this. And then we want you to believe. Perhaps what they're saying doesn't make sense. Perhaps it seems inconsistent. You don't need to determine that in those first moments. By affirming them for sharing with you, and by believing them, you're providing those early moments of them feeling safe. Later on, if there's something inconsistent or untrue, there will be plenty of time to sort that out. But in the moment, by breathing, listening, affirming, and believing, you're providing them with a sense of safety and stability. After you've done all that, that's when we think about doing the other associated tasks. So first, both collecting a little information, but again, not feeling like you have to ask detailed questions, collecting some information, and then providing some information as well. So you can provide some information about the symptoms of trauma. So if they say, I've been worried, I've had nightmares, I feel sick to my stomach, you can say things like, it's really normal for someone who went through what you went through to be feeling that way. And then there's the tasks. So whether you need to write a report, whether you need to make a call to report this, or whether you need to provide the person with referral information and resources, that happens last. Now, obviously, when we're thinking about reporting things, we want to do it in a time-sensitive way. So I'm not suggesting that this process that I just laid out for you take 2 days. Really, it should take a matter of, less than an hour probably. But by first going through that process of listening, affirming, believing, we're not giving the impression that we don't have time for what they're sharing, or that making the report is more important than them as a person. A lot of times relationships can go through a sort of rupture when these crisis moments come up. And so if we can just center ourselves and be really fully present immediately after somebody shares something, it can go a long way towards helping that trauma recovery process begin right then and there. In your roles, you often have opportunities to support parents, caregivers, and families. And I think it's really important that you take some of the information that we've learned today and in the past 3 modules and share that with these parents, families, and caregivers. So emphasize the belief that people heal from trauma. We know that for sure. And that does not exclude individuals with developmental disabilities. Also, continue to view people through a trauma-informed lens. A lot of times we may not know if a person has survived trauma, but there is absolutely no risk in assuming that a person has, because the same kinds of things that benefit survivors of trauma benefit all of us. Again, focusing on resiliency and recovery, and recognizing that the family members, the caregivers, the parents, what they want is to find the best care for their loved one. They want to find the supports that are going to help that person heal and gain or regain autonomy and independence. They want to help that person gain a meaningful life and to fully function. And especially in the aftermath of a trauma or in the aftermath of learning of a trauma, it's really important that we acknowledge that we understand that those are the things that they want for their family member. We also want to remind the family member, the parents, the caregiver, that there are a lot of protective and resiliency factors, like their support systems, the relationship they have with the person who might have experienced trauma, the coping skills, cultural aspects, whether that's different kinds of family traditions, spiritual or religious practices, cultural holidays, events, things that they celebrate together that emphasize healing and joy and being present, as well as having a supportive school and community environment. All of those things are really helpful to the healing process. And reminding people that that's part of the puzzle too is really important. And then validating the sense of grief and loss. A lot of times when people experience trauma or when their loved one experiences trauma, it exposes them to something in the world that previously they hadn't been a concern for them. So whether that's a natural disaster like a hurricane or a tornado or a house fire, or an act of interpersonal violence, there's a sense of loss, of losing that sense of safety, as well as whatever life existed before, that acknowledgement that things are going to be different now that this trauma has occurred. And so validating that you understand that, and also that we can't go back and erase the trauma, but we can work towards healing. And we do know that people do heal and recover from trauma. We want to normalize that there is stress and strain on all relationships, and that we should continue to engage. Sometimes family members will feel worried, like, I don't know, should we still celebrate Christmas? And I'll always say you should do all of the things that your family typically does that feel great, and that all of those things build up resilience. I think it's helpful to explain the basics of trauma in the brain and how it happens to help people have a frame of reference for what's going on here, and to check for signs of vicarious trauma within the family members and caregivers. And we'll talk more about that in a minute. We want to provide referrals for the family members, identify all of those protective factors that we mentioned, and enhance those protective factors. So do everything that we can to encourage them to deepen those protective factors in their life. Answer questions to the best of our ability, and if we don't know the answer, say that we don't know the answer, but that we're sure there's a way to research that and find out. And to provide some realistic timelines, not to say, well, in 2 weeks they should be feeling better, but that this is a process that everyone moves through on their own timeline. And what we can say for sure is that people can and do heal from trauma. We also want to promote family-informed and person-centered planning. So whenever appropriate, that we're getting people involved in the planning of their own treatment, that we're focusing on strengths, that we're highlighting those resiliency and protective factors, and that we help the individuals, the families, parents, caregivers feel like an expert in what they know about themselves and their loved one. And that, again, we focus on recovery, not a cure. That all the stuff that we do to heal from trauma is part of a recovery process. It's kind of like having a sports injury that will require attention from time to time, but that will eventually mostly fade away. And maybe we'll feel a little sore when it rains or when it's super humid or when we overuse that part of our body. But that it's something that's really about recovery and an ongoing process of recovery and attention. We want to use stress management and relaxation techniques for the whole family. Understanding that quieting down these trauma responses is another piece of the puzzle. We want to help people to really recognize the value of de-stressing and having these relaxation activities in their life. Building a trauma-informed world requires us to spread the word about trauma. So I'm relying on all of you to take this information that you've learned and share it with someone. Share it with the families and individuals that you work with. Share it with your colleagues. Share it with your family and friends so that people can understand the impact that trauma has in all of our lives. By explaining these things to people, it helps them to recognize symptoms of trauma in themselves and one another. And by having that information out there in the world, we can help people to access the supports that they need to start that recovery process. Early interventions for anything always improve the outcomes, and trauma is no exception. And so we want to help people to recognize when these symptoms are happening so they can get themselves some support and so they can acknowledge, okay, so this is what's going on. I'm experiencing some symptoms of trauma. We want to use some really basic skills, some grounding skills, breathing. One of the things about trauma that we saw when we looked at the brain is that a lot of the information that our brain takes in the moment of trauma is through our senses. So smells, sights, sounds, tastes, textures. And so if trauma is stored in our senses, the best way for us to provide some healing is also through our senses. Now, not everybody has access to all of their senses, and that's okay. We can use the senses that are available to us to provide some healing moments. So for example, providing some comforting sense, textures, having something that you can rub your hands against, sounds, making sure that there's comforting sounds, taste, having a taste that's comforting that you enjoy. And by attuning to all of these senses, what we're able to do is help bring ourselves back to the present moment. If the person that you're working with has access to sight as a sense, finding images that are really pleasing to them and showing them those images and asking them to really focus on the picture. If they're able to use any kind of verbal communication or any other type of communication, ask them to then describe that picture to you in great detail. By doing so, it forces them to focus in the present moment, and it allows them to tune in to using those senses for something that's healing and relaxing. And lastly, instill hope. Healing is real. I am a trauma therapist and I have seen it happen. It doesn't happen immediately and it doesn't happen the same way for every person, but healing really, really does happen. And by putting ourselves in touch with this idea that healing happens, we can instill hope in the individuals and families and communities that we work with. So the last leg of this is supporting you. Some of you might have heard about this trauma-informed approach and have thought, that's something that I already do. And likely a lot of these things are part of what you already do. And so I encourage you to let this trauma-informed information soak in and to let it shift the way that you see yourself and those around you. Using a compassionate lens towards ourselves and others is a wonderful benefit of being trauma-informed. It can help us feel less angry when somebody is rude to us. It can help us to feel more understanding when something in a relationship changes. And it can help us be more patient with ourselves when we're not able to function at 100% all the time, and especially not after something difficult has happened. Find others who understand this idea of being trauma-informed, and you can support the work of one another. A change in perspective can be difficult, and it can bring about challenges, so be gentle with yourself. Seek support, surround yourself with resources and reminders, and tap into what it is about your work that's meaningful. Maximize those moments. One of the best things about this trauma-informed approach is that the goal is not to fix something. It's not to fix something that's broken, to be constantly working towards resiliency and recovery, and to recognize that on one level or another, we're all works in progress. And that's really part of being trauma-informed, is being patient with that process and knowing that it is about the process more so than the outcome. I also want to remind you about the real risk of vicarious trauma, because for me, vicarious trauma is not an if, it's almost a when. If we work closely with people who experience trauma, we are at very high risk of being vicariously traumatized. And what being vicariously traumatized means is that by connecting with the experiences of those who have experienced trauma, we take on some of their trauma in a sense. And so what ends up happening is that our symptoms start to look like those of the trauma survivors. We're jumpy, we're frightened, we're hypervigilant, we're hyper-aroused. And so we take on all of those trauma symptoms because of how close we've associated with the trauma. So what we have to do is we have to work on focusing our efforts to changing the systems that we live and work in. Individual efforts, self-care, are one piece of the puzzle, but they're not the whole story. And in fact, compared to other types of changes, they make a pretty small amount of impact. So getting support from people that we work with, encouraging systemic change, so encouraging within our work environments, a reminder about the impact of vicarious traumatization, a space for talking about vicarious trauma, and for getting support to work through it, advocating for ourselves and for our colleagues that when we work with highly traumatized populations, this is something that is likely to occur, and making sure that we do what we can to provide that support for ourselves and for one another. And then, even though it makes a smaller impact, remembering your own self-care. A lot of times when I ask students, what are you doing for self-care? They rattle off this long list of hiking and yoga and meditation, and those things are all wonderful, and I hope that some of you are doing those activities. But I also think that the worst thing we can do is judge the things that we do for self-care. So if part of your self-care is watching ETV or watching Bravo or zoning out to Netflix to the point that you get the little message where Netflix asks you if you're still there, those things are all okay. The important thing is that we take stock of what fills us up and what drains us, and getting really familiar with what it feels like to have more or less energy depending on the activity that we're engaged in. So if you watch 8 hours of Law & Order SVU and you feel energized and hopeful and optimistic, perhaps that's a good part of your self-care plan. But if afterwards you feel scared and disheartened and hopeless, maybe that may be something that you want to shift up. So we want to acknowledge our own trauma and triggers. We want to recognize the signs of burnout and impairment. We want to find an accountability partner. So find somebody who's going to check in with you every once in a while and say, what are you doing to get some self-care? We want to watch TV that feels good. We want to read books that feel good. And we want to give ourselves permission to say no and to set the limits that we need to feel protected in our work. So lastly, what I want to say is that, again, as much as we know that trauma impacts people, we know that people do heal and recover. Our brains can begin to build new pathways. Instead of moving from the smoke alarm going off to immediately reacting, we can build in that moment where we say, am I safe? This feels really dangerous. Is it dangerous? The brain research that we have is really encouraging, and it shows that people can heal. And so the more that we understand the ideas of healing and growth and recovery, the more we believe that this is possible. And so I really want to encourage you that it is. I want to thank you so much for being with me during these videos and for bearing with me as each video exceeded the time limit that I laid out for you. What you've done in these 4 modules is you've taken the first steps towards really integrating this trauma-informed approach in your work. And for that, I'm incredibly grateful. I wish you so much luck and happiness in all of the work that you do. And I hope that you'll find this information meaningful in your personal and professional lives. Thank you so much.